Good morning and welcome to today's Thought Leader discussion, hosted in partnership with NYU-DC, the Bradamus Center, the School of Global Public Health, and New York University. My name is Cheryl Healton, and I'm proud to serve as Dean here at GPH. For those who are unable to join us today, this event is being recorded. It is now my pleasure to welcome Steve Davis and Blessing Amawaku to discuss Steve's new book, Undercurrents, Channeling Outrage to Spark Practical Activism. This book is especially timely given how divided our nation is and how deeply our population feels about their views, from the pandemic to politics. Even the act of not wearing a mask to avoid the spread of corona here in the US has become a political weapon. Our focus today will be on how we can harness forms of outrage and channel it effectively to spark positive change around the world. Our speakers include Steve Davis, the former president and chief executive officer of PATH, the Seattle-based international nonprofit organization that works to transform global health through innovation. Steve serves as the co-chair of the World Health Organization's Digital Technical Advisory Group and holds a faculty appointment at the Stanford University School of Business, teaching social innovation. He is also a member of Challenge Seattle and the Council on Foreign Relations, and serves on several boards and advisory groups, including ours here at NYU GPH. He is currently leading Gates efforts in China. Blessing Omaku is a self-described lawyer turned policy wonk. She is a Nigerian-American women's equality advocate, strategist, and writer. Last year, she served as the co-curator of Melinda Gates' session on gender bias at Goalkeepers, New York City. She is the deputy director of Goalkeepers at the Bill and Melinda Gates Foundation. In 2017, Blessing was recognized as one of the top 50 emerging global policy leaders by the British Council. She also founded the She Tank, a modern think tank supporting the realization of equality for women of African descent. Blessing's research and work focuses on human rights and women's equality. Steve, let me first turn to you to talk about what motivated you to write this book.
Well, thanks, Cheryl, so much, and greetings everybody from a very, very rainy Seattle this morning, which is sort of the nature of Seattle in this month. But and I'm so delighted to be here, and particularly with these two amazing women, Cheryl and Blessing, who I respect deeply for the work they continue to do to change the world. And yeah, I'm very also excited because I've really enjoyed serving on the NYU advisory board with Cheryl and learning so much about what a great set of programs NYU has around the world and all the work. So it's a double blessing today, or triple blessing, I guess, with Blessing. There we go. Yeah, so look, I've had a fairly varied career, and I've been listening and learning a lot from others around the world, but particularly a couple things kept coming up over the last 2 or 3 years. One is noticing how many people I knew were just simply discouraged. I mean, outraged, but also discouraged, often paralyzed, like not sure what to do with this. And, you know, how do I move forward? The world seems to be so crazy and all these challenges. And so there was a sense of, you know, how do you help people who feel paralyzed? And this was colleagues, friends, family, students. And then the other sort of corresponding thing that was coming up in these conversations was the sense that everything was continuing to just, you know, go downward. Like there was a downward spiral, every trend was bad, and I started thinking about both of those problems because I'm by nature a bit more probably optimistic, but I also read a lot and kept thinking, well, wait a minute, that's not quite right. That actually the headlines are pretty discouraging, but the trend lines for many things in the world are pretty cool, are pretty good. And so how do we rethink the way, maybe help people think a little bit differently about the way they can engage? So the book has really two then themes. One is some trends I see, macro trends, which I call undercurrents, and there's this whole sort of water metaphor going on in the book that we can talk about. But these macro trends that actually are large, and they're kind of below the surface maybe, but they're very powerful, and they're not new necessarily, but they're very powerful for social activism and social innovation and social justice over the next decade. So let's, with the idea that those are trends that you can, kind of jump on and hopefully build on and give you courage or give you some momentum. And then the second is, well, okay, then how do we do that? And a little bit more about sort of what I call practical activism, which is you do that by sort of rolling up your sleeves and figuring out sort of practical ways to engage. That we've sort of turned activism, and a lot of my friends were sort of, activism has this big scary word. You either have to become, a street activist or a celebrity or a big philanthropist or like some brilliant, social entrepreneur to be a social activist. And the reality is social activism has always been, folks sitting around their kitchen table figuring out how to solve a problem in their community. So I wanted to sort of say, look, you can use these 5 trends and hopefully find ways to become a practical activist yourself.
Well, that's a terrific overview of what is a terrific book, as I've already mentioned to you, and I was very excited to read it, and it really remotivated me for much of the work that the school is doing. So we will, in a moment, we'll be opening up for comments and questions from the audience. But first, I would like to tee up a few questions to both of you. For Blessing, what has the Goalkeeper Report shown is happening to the SDG progress in the face of COVID? Maybe it's not even being registered yet, but what in your own travels have you learned, and what are your concerns?
Thank you so much, Cheryl, and thank you for the warm introduction, and Steve for inviting me to be a part of your conversation. For those who don't know about Goalkeepers, let me start there. Goalkeepers is a catalyst for action on the SDGs that the Bill and Melinda Gates Foundation started in 2017. And the Goalkeepers Initiative does a few things. One is we use data to really highlight where we are on the SDGs each year, where progress has been made and the work that still needs to be done. So we publish an annual report. We also have campaigns, awards, and events that we use to celebrate people who are doing fantastic work, the people that we call goalkeepers, and to inspire action. And so every year we'll give out annual awards. Usually we have an event. This year we didn't have an event in New York, but we usually have an event in New York around UNGA Week and in different countries as well, to inspire just progress and celebrate those who are doing fantastic things. And then we also celebrate the power of partnerships through our accelerators. Our accelerators are ways that we drive and highlight people who are partnering in fantastic ways to advance the SDGs. And so usually our report every year is usually, I would say, positive. And this report was positive, but it was also discouraging in some ways. We often have celebrated fantastic progress and said we've made this much progress since the SDG started, and we're either on track or not, but in most ways it's been very, very positive. But this year it was frankly a bit discouraging, the data that we came across. COVID-19 didn't just stop progress, it kicked it backwards. So for example, with vaccine coverage, we partner with IHME. IHME is our data partner. And we found that the vaccine coverage levels have dropped to levels left in the 1990s. So we were set back 25 years in just 25 weeks. But one of the biggest catastrophes that the report covers is not just the health effects of COVID-19, but the economic impacts. So as of September, when the report was published, we found that extreme poverty had gone up by 7% in just a few months. It had pushed over 37 million people into extreme poverty. And in America, we saw that people of color were feeling the impacts most. So as of September, about 23% of white Americans were not able to afford rent, but 46% of Black and Latinx Americans were not able to afford their rent that month. We saw that women were actually being impacted most by COVID. Melinda Gates just published an article in the Washington Post a couple weeks ago, I think last week, that showed that about 1 in 4 American women are either considering downsizing their careers or leaving their careers completely. In the Goalkeepers report, we talked about women in the African continent who often work in the informal sector. Many of these women now work in places that are not accessible, like markets, places that are now closed due to COVID. So they're having different kinds of economic shocks. But overall, our tagline for Goalkeepers is that progress is possible, but not inevitable. And so while the results and the data this year are quite discouraging, we still believe that progress is possible. And I think this goes to some of Steve's points around collaboration, how we need to come together and not see this as a zero-sum game. So I'll pause there.
Wonderful response. So just to keep with the theme of potential problems and what they reflect, as COVID has clearly reflected an inequitable divide. How is maternal mortality, an area that I know you have worked in, a lens for through which one can further evaluate inequity?
Great question. I started working on maternal mortality. Well, I had researched it for a while. As a law student, I was really interested in women's human rights, and that was reproductive rights, was something I began to research as a law student. But working in Nigeria, I was working for an organization called the One Campaign, founded by Bono and others. And in the Nigeria office, the office had just set up in 2016. Prior to One even joining the scene, there were activists in Nigeria and policy wonks who had been working for years to get a National Health Act passed. So CSOs began to converge around this in around 2004, 2005. And for 10 years, lobbied for the government to pass the National Health Act. And that act was finally passed in 2014. But the basic funding mechanism of that act had not been implemented by the government. So the funding piece of that act said that the government had to have 1% of our consolidated revenue fund, which is our total budget, go towards basic health care. And the average Nigerian accesses health through primary healthcare centers. And so this funding would ensure people had access to the basic minimum package of health services. But that hadn't been passed for 1 year, 2 years, and 3 years. And One then joined the scene around 2016, and I joined One in 2017. And we said, okay, how do we get the government to actually implement this? And one of the reasons that maternal mortality is so key is that Nigeria has the second highest rate of maternal mortality in the world. The average woman in Nigeria accesses health through primary healthcare centers. And for me, the equity lens there is this: class. The woman who is rich in Nigeria can afford to travel to a different country and have her baby. She can afford private healthcare. But the average Nigerian woman cannot. She goes to public hospitals. She relies on these services. I think the World Health Organization said that Nigeria contributes about 20% of the global maternal death burden in the world. And so we're really advocating for this law to be passed. And through a lot of advocacy, working with popular culture influencers, actors, musicians, working with CSOs, working with coalitions, we were able to, for the first time in 2018, that law was passed. But from a personal perspective, I'm Nigerian American and I've lived in both Nigeria and the US. I see in the US, while the issue is class in Nigeria, it's race in the US. So my sister, for example, went to have her baby in Georgia this year. And she got to the hospital and was in labor. She had called and her contractions were 90 seconds apart. And she got to the hospital, they had told her to come in. And they said, you don't look like you're in pain. And she was like, well, I am in pain. I'm telling you I'm in pain. They're like, well, you don't look like you're in pain. Go home and come back when you're in pain. And she was in so much pain that she could barely walk to the car. And so she had to stay in the waiting room because she had been discharged. At our Goalkeepers event last year, we had Dr. Joya Queer-Perry, who is a fantastic woman doing work around racial equity in the US. And she talked about how women in America die, Black women in America die, I think at a rate 3 times higher than white women in the US due to racial bias in the health systems. And often it's because Black women are not believed when they say they are in pain. My sister had lots of health complications, but thankfully she lived. She's one of the lucky people, she lived. I see that and I've gone on a very long-winded journey here, Cheryl, but basically I think maternal health shows us how in the US, race can be a barrier to good health. In Nigeria, class can be a barrier to good health, but they all point to equity.
Very good. That's an excellent answer and very helpful. Steve, what can and should we do to shorten the valley of death, which you can explain to our listeners, in areas of social innovation?
Great. Well, first, let me just pile on a bit on Blessing's comments, which are always so valuable. But first, I think the idea, I always say progress is happening, but it's neither inevitable nor is it equitable. And we need to, it's both in, and we need to be focused more and more on, thoughtful programming. And I'm really delighted to know that, NYU is thinking about that, and others around more the lens of racial equity as it applies to global health and development. Look, one of the things I write about in my book is this thing, and this is what I teach at Stanford, is the work of scaling social innovation. So innovation might be a new idea or a new product or a new financing mechanism. And it's always, we celebrate a lot of the new ideas. We kind of, as a culture and as a global health and development community, we kind of love the sexy new things, which is great. And, we give a lot of prizes and, the Nobels and MacArthur's and all that to people who do the grand challenges. And we're actually beginning to be a little better about also focusing on last mile delivery. And there's some great organizations and focus. But I always talk about the distance between the inventor's garage, using the sort of Silicon Valley metaphor, and the last mile delivery, whether that's East Palo Alto or East Nigeria or Northern Nigeria, is a huge and long and complicated journey. And it's usually the one that people don't talk about. Frankly, we don't do a great job educating or training people to do. And it's where the opportunity for a lot of practical activism lies. And this sort of what I call the unsexy middle, which I'm trying to make sexier. So like make it more attractive for students and activists to engage there. And that really takes us across what is often referred to as sort of a value chain, from early innovation and ideation through kind of adaptation, through registration or getting people to endorse it, to to figuring out how you create demand, to getting it piloted, to getting it scaled up. And we talk in that about these valleys of death. And this is something that if you're involved in investments you hear about, or you involved in life cycle in pharma or any kind of drug discovery, these places along the innovation value chain where either financing isn't very adequate or there's a lot of tough hurdles to cross. And in the social innovation area, the work of taking great new ideas and getting them to scale, we face a couple of big ones. I mean, after a cool new idea is put together, and it might even be tested to show that it's workable and it's effective, trying to get it all to somebody to fund it and adapt it and get it to a place where it can actually be launched. That's a lot of extra work. And then once it's even launched, there's a lot of work getting new markets, particularly in the work we do where there may not be natural market forces at work. So you have to figure out other ways to create demand. And so the question then is, how do we shorten those things? Or how do we make that an easier process? So some of I teach in my class, I teach about some of these really simple, really cool ideas that were dramatically impactful for global health. Like I talk about the little thermo sticker, which came off of a literally perishable food package that you see in your local supermarket, where they see if a chicken has been thawed and unthawed. You'll see that there's a little sticker that shows it's been thawed or unthawed. Well, in our lab at PATH many years ago, somebody saw that and said that could be applied to a vaccine vial. And then we would know whether the vaccine went out of the cold chain, which is, really important. And it's become very focused right now with COVID, where we have to keep these things cold between a manufacturer and the village or the community it's receiving it. So actually 40 some years ago, that idea came out and we started working on it, but it took about 30 years to get it to be adapted because of all these valleys of death. Who was really going to finance it? It was a lot of extra hassle and cost to manufacturers, even though, they weren't going to see any added return in terms of their investment. It was, a lot of, well, it sounds like a good idea, but, we're hoping refrigeration gets better. There were also competing issues. It wasn't really clear, the value proposition. So we see a lot of that we're seeing great ideas that never get to scale or take way too long. So some of the work is to say, how do we shorten that journey? First of all, we need to put more resources there. We need to get away from resourcing so much on the invention side and start resourcing better the adaptation and scaling side. The second is we need to understand how important, multi-sector partnerships are in that. So in the social sector, we tend to hold on to things we do and not, we see and we want to take them and run them all the way to scale by ourselves. In the private sector, an innovation usually gets handed off 3 or 4 times on its way to scaling because people with different capabilities can distribute it better, et cetera. Now we have, we have financial incentives for that to happen too, with exits and mergers and things. And then we don't have those in the social sector. So we've got to figure out how to build better partnerships across government, across private and social sector. And then we've also got to work a lot more on policy. And the policy underpinnings of all of this. So the road to scaling social innovation is a public, usually it goes through the public sector. And in many ways, it's the policy arm of the public sector that matters. It's also the procurement arm, actually. And so we need to spend more time on policy. And I'll tell you, so I can just, wrap this one up by saying it's really become apparent this year in COVID. I've been chairing co-chairing as Cheryl mentioned, the WHO's Digital Health Advisory Group, and also we're working with the World Economic Forum on their digital health strategies. And COVID has been an amazing journey, right? I mean, it's been horrible and tragic, and we're still in it, and we can go on and on about all the horrible mistakes made. But it has, on the digital side, been extraordinary, the amount of innovation coming from all over, and incredible products, incredible tools, incredible commitments, incredible collaborations from all the way from testing and tracing all the way down to modeling. We all know what flattening the curve looks like because of digital, visualization capabilities. But it's exposed horribly how incoherent this system is, how it lacks underlying frameworks, it lacks underlying principles. We don't have clarity on interoperability, or we don't have clarity on privacy rights, et cetera. There's no mechanism to get great digital tools to the places that need it the most. There's no sustainable financing for that. So we've got a lot of work ahead to solve those valleys of death in digital health and digital development.
That's for sure. You gave many wonderful examples in your book, and I must say I was quite struck by the length of time from a bright idea, like the solar light, to when it's literally out the door. And the same was true for the drones, and on and on. And it does really make you wonder, what can we do to kind of shorten that? So that was a terrific answer, and thank you so much. I do want to remind the audience to feel free to put in questions into the Q&A. I have another for both of you that I know will be inspirational, having listened to you speak and talked to you earlier and having read the book. What has activism meant for your careers? And I'm going to start with Blessing, who I know has had the blessing of a fine career and has done an extraordinary amount of work to change the world.
You're kind, Cheryl. Thank you. No, when you were speaking, Steve, about the unsexy middle, I think a lot of the work that I've done in the policy space has been behind the scenes, and it's always hard to think about, well, is that activism? For example, we spoke about the work on the National Health Act in Nigeria. First of all, activists were working on that for 10 years. So there's a lot of time that goes into just like developing these very technical and wonky languages, working with the medical community. And then we came in and did the work that I could do there. But a lot of my work has been within organizations. I see myself in 2 ways. One is I see myself as an introvist. I call myself an introvist because my activism is internal, it's within organizations. So I really focus on racial equity, for example, in organizations. What does that look like? How do we have better policies? I've chaired internal working groups in different ways to say, how do we improve our policies for caregivers, for mothers? That matters to me. How do we make sure that our programs, our grants are accessible to people from different countries? That really is the core of my work, is working from within structures to decolonize them and make them more accessible to the people that we are supposed to serve. The other thing that has been important to me in my career is what I call rightivism, and that's my work writing. So when I moved back to Nigeria right after law school, and I was working with a member of the House of Assembly, our version of Congress. And at that time, I'm still young, but being a younger Nigerian woman who was unmarried, it was so interesting the challenges that I faced as a woman in Nigeria. We'd go to meetings and people wouldn't take you seriously because you don't have a wedding ring on. You know, you'd go to government meetings and be like, who is this little young girl speaking on this panel? And I began to write about my experience. I began to blog about what it meant to be a woman and to be a Nigerian. And for me, that was a form of activism because it was storytelling, it was talking about the things that we often didn't talk about. And through that process, I began to write about the intersection of religion and gender equality, which is huge. Religion frames so much of our thinking around so many social norms, including gender. And it was tricky because religion is very controversial, right? It's very tricky to write about religion. And I come from a faith background. My parents are faith leaders. But I found that to be incredibly insightful. It led to so many conversations. People were emailing me and saying, I've never thought about XYZ yet, you know, that way. Because I was really taking the Bible and saying, well, let's re-examine the Bible from a lens of equity. And that led to me wanting to start the She Time because I realized that there's just like a hunger to have these conversations. And so I don't see myself as someone who is necessarily the activist on the street, although I have done that and I have a great respect for it. In Nigeria, the NSARS protests, you know, just went live, and I'm so proud of the women and the men and the people who are part of that movement. But that's not my place in the space. I'm the person who is behind the scenes working on the policies. I'm the person who is helping to shape the strategies. I'm the person who is saying, how do we elevate the person who is on the front lines, on the streets doing X, Y, Z? So a lot of different ways to come at it, but that's how I see my place in the space.
Well, you're doing a wonderful job at it, and I will definitely want to have, and I think others on the faculty and the staff and the student body here would love to have a conversation about the work that you're doing to achieve racial equity within organizations, because the whole question of systemic racism and how it manifests itself in universities is for us a very hot topic, and one that I care deeply about, and many, many, many people at the school care very deeply about, and are deeply focused and appropriately so on. Steve, what has activism meant in your career?
Well, I just wrote a book about that. No, it is, look, you know, I think my answer is not that different. I mean, we've had very different paths, but Blessing and I are probably kindred spirits in some of this, that I too am a great admiration for people that have protest in the streets, call attention to a problem, or, you know, and people that, you know, celebrities that have voice and power and money that to make, you know, give visibility. So all of that I endorse, and I know how critical it is. But my place in the ecosystem as well tends to be a little bit more behind the scenes, a little bit more kind of the you know, as I mentioned, kind of, you know, somebody said to me the other day, I'm one of those people that you don't call for necessarily the best new idea. I can come up with a few, but if you want to get stuff done, usually it's not the word stuff. You know, I'll figure out how to, you know, pull the team together and get the pieces put together, build a jigsaw puzzle, figure out the chess game. I can. So mine is also tends to be a little. I don't know if I'm quiet, but it's a little bit more behind the scenes, because I believe so strongly in this idea of one of the forms of practical activism is being a bridge builder, bridging between sectors, between people of different beliefs. I write in my book about not only, you know, crossing, you know, one day being in Zambia and working with sex workers, the next day, I'm literally the next day in the Four Seasons in New York talking to hedge fund managers about why these worlds are not as far apart as you think. But also bridge building between ideology. You know, I may have strong political beliefs, but I believe we just got to all work together more off right now. So acute in my country, but around the world. So that's been my form of activism. A lot of that actually came out of my life experience as a young man or boy in rural Montana, a very isolated community I grew up in, very homogeneous. Everybody was white, everybody was Christian, everybody knew everybody's business all the time. I mean, it was that kind of small town, 3,000 people. But I was also realized by the time I was in high school that I was gay, and you know, that journey for me, which has taken, you know, a lot of years to figure out, but I'm, you know, happily, you know, married for 40 years now, and or partnered, I guess. We weren't allowed to be married half of it, but but that journey, you know, is where I learned a lot about, okay, where's my comfort level of being a gay activist? What part of the, and so during the AIDS crisis, and we were living in New York and I was in law school, you know, I did participate in street protests and I was really active and loud. And yet I found myself adding more value, I thought, when I was then more quietly working on litigation strategies or, you know, building some communities behind the scenes. And so that's where I found my more comfort place. And I think it's still what I'm doing today. I mean, in fact, this afternoon, I'm, you know, quite involved in a very complicated set of conversations around the role of the Chinese vaccines and the COVID response, and yeah, and working with the global community and a lot of global leaders on that, sort of quietly and behind the scenes, maybe not fully behind the scenes, but there again, it's about bridge building. It's about trying to be practical. What do we need? What do we work? Trying to take some of the ideology out of it if we can, and all the myths that go along with that, and figure out how we can do the best thing we can do, clearly scientifically and with safety and efficacy involved, but also to move the needle on ending this horrible pandemic.
Well, that's a terrific answer from both of you. We now have a number of questions that are coming in from the audience. One is, what do you see as the greatest challenges to realizing the SDGs? We can start with Blessing if you want to collect your thoughts. Whoever wants to go first.
I'm happy to give you a little time for a Blessing. I can see your brain is whirling. I think there are two. I think that we've I mean, the SDGs are very ambitious, and we've got to recognize that, you know, we are behind, and now we're further behind, as Blessing mentioned, because of both the health crisis, but it's, you know, cascading economic and humanitarian crises that COVID's generated globally. So I think it's still a very audacious goal, but I think we still need to keep driving completely toward it. And I think the two biggest things we've got to work on is, honestly, I think this idea that this is this concept that it's for all of us. This isn't a set of goals that's for you know, lucky people helping the unlucky people, or the global north helping the global south, which is not a framing I like to use anymore. But it's about you know, the entire planet and the entire species working on things that are going to be critical. And I still think it's still kind of relegated to kind of, oh, that's what those folks up in the UN or places like the Gates Foundation care about, versus that's what people and corporations should be thinking about as they think about their ESG goals. And it's where, you know, they may not use the word SDG, but these concepts are critical. So I think getting more people around the table and getting more people engaged and at the party, I mean, all of that's going to be critical. And then secondly, I mean, it's pretty blunt. We need more money. And we're going to have to figure out how to fund this because it's some of it will be driven by markets, some of it will be driven by governments, but we've already seen the sort of the lag that's being created because of COVID on the global vaccine coverage. I mean, and that doesn't even get to some of the other SDGs that are more driven around the planetary health. And it's going to take not just, you know, philanthropists throwing money at it, but some serious rethinking of the way, you know, wealth is created and then delivered and distributed in the world. And that's, you know, I think that's front and center. I don't know if we can solve it. It's a big, messy thing, but it's a big problem for us.
Great answer, Steve. Blessing?
Yeah, no, I mean, that question was interesting because there's so many challenges to start with and so many potential solutions. And I was like, where does one even start with that question? But a few things, and Steve has hit on a few of them. Funding is obviously key, but I would start from the ground. I think there's so many normative issues that we need to work with to accomplish the goals. Social norms are huge. What are the norms that we have around health practices? So we've seen that, and when we talk about norms, often our minds will go to Africa, the African continent, Asia. But even in the US, what are the norms that we had around wearing masks during COVID? You know, like thinking about what social norms are and how we can tackle those. and the work that I've done around gender, there's often a focus on, well, let's do this big grant and let's do this big funding for this. And I always say you can fund all you want women's economic empowerment, but if she's going to a church or to a mosque and she's being told you should not work as a woman, your only place is in the home. I've seen women who are incredibly educated. I was attending a church service at home the other day, and people were giving testimonies about how their wives quit their medical careers. You know, this was being celebrated as a testimony. Until we can tackle those kinds of norms, we won't see progress on SDG 5, for example, or norms around health. We won't see progress on SDG 3, or even norms around poverty. We won't see progress on SDG 1. So that's one big thing for sure. I think the other thing is thinking about what equity looks like. I think so many of our solutions in the development space have been centered from the US. They've been brought up from the US and from Europe, from quote unquote, or so-called developed nations. I think until we begin to decolonize development, we will not see the solutions that actually work. So for example, we can invest all we want in these great toilets that advance water, wash, water, sanitation, and hygiene. But until we're engaging people who are in the community, so we can say, you know what, unless you actually build a kind of stall where a woman can take her child into it, you're not going to see success there. So I think decolonization is really, really huge. I think partnerships are key. And partnerships that take us outside of our sector. So much of what we talk about happens in this really small space of development. And until we begin to make the SDGs quote unquote sexy, I think we have a long way to go. We need to bring it into mass consciousness. I think the US, we've seen in really fantastic ways the way social justice movements have become mainstream. I think the SDGs also need to become mainstream. How do we bring it into mass consciousness? Even if people don't know the technicalities of here's the indicator for SDG 10 or 1, can people know that we have these 17 goals and that here's the progress that needs to be made? And the final thing I'll talk about is data. Data is not fun. I'm not the biggest data nerd in the world either. But I think that until we go back to solutions that are grounded in truth, grounded in fact, that are based on data, we have a long way to go. And we don't have all the data that we need to solve basic problems. I mean, think about poverty, think about gender. Some of the data doesn't even exist. And so I think we need to begin to build those systems to collate the data and to build our solutions based on those data points.
Yeah, those were terrific, terrific observations, and quite a challenge built into them, particularly for the important goal of decolonization. So here we go. How can we channel messages from racial justice demonstrations into progress in establishing racial justice? This is from Jeannie Engel.
Well, I think it's, first of all, I think it's super important to, I think there has been a moment, and we'll have to build on that moment, whether we are successful in doing that. And I say we very collectively. It's not, I have no ownership. I mean, I own it as a human, but I don't, I'm not in any way a driver of that. But whether we do, and I also think one has to be careful how this is playing out in other parts of the world versus the US, and being very conscious that these issues show up differently in different cultures or different communities. And so I've already been involved in some conversations where we're applying sort of the way US is thinking about it in other parts of the world. And it's like, that doesn't really work. So we have to be thoughtful about that. But I do think there are things that are happening. I mean, I have watched in the last 6 to 12 months, organizations with which I have been involved with for years starting to actually wrestle in a more authentic way about what their world looks like and where they are not, particularly in my country, in the US, around Black Americans, where and how we've not seeing the kind of progress that people coming out of the 60s imagined. And so, I mean, I can tell you one example, I mean, but it's showing up in every conversation I'm in. And I, question, this is a bit the trend of the month, or is it long term and sustainable? But I feel like what's interesting to me is seeing how it's not just, kind of the traditional social activists. It's translated beyond, the protests and the usual suspects, which would be people like us who are, involved in social activism professionally, into the boardroom of big companies, and into conversations at kitchen tables in white suburban communities. And while there's still a lot of pushback and counterlies, I always think that's kind of good, because it means that we're doing something. And so I was involved even in Seattle, and this is a pretty typical, generated a lot of wealth, struggling a lot in COVID, but two of the richest people in the world live here, some of the richest companies, and yet we see, and it's a pretty white community generally, just data wise, statistically, relative to a lot of other big cities in the world, in the country, but a real conversation has started, and there's been a commitment by the business leaders and they've gone public on it in the last week, to make a bunch of changes, and they disagreed, and I was at those tables, not to put out a statement in May in support of of racial justice. They said that wasn't enough, but what we need to do is huddle, understand the data, to Blessing's point, get a better sense of what's really happening, and then come up with actual commitments, and commitments in our recruiting practice, commitments in our putting money on the table. So it's committed $2 billion among them to racial equity programming, committed to revisiting leadership commitments, made solid commitments and went public with it. So I do think there is a opportunity that we can keep building on. Now we'll go backward. Civil rights and human rights issues always do go 2 steps forward, 1 step back. But I think that there's a real opportunity right now to build on that.
Terrific response. So the next question is from Malcolm Gisson. I retired as a wealth manager in San Francisco to work with 5 nonprofits in reforming California prisons, getting deserving inmates released and into good jobs and secure housing. All these groups, especially the most effective one, are grossly underfunded. How can they build a strong base of affluent supporters for financial support, and also take their ideas for reform to a national scale? Advice for a movement, it sounds like. And very important.
You want to go for it, Blessing?
Sure. Well, can I also just go back to the question right before that one, and then I'll come to this one, the question around racial equity.
I apologize. I'm so confused. I thought you both responded. Forgive me. Forgive me.
No, just I quickly wanted to add to that I think, there's so many solutions and so many people who are producing excellent thought and have been talking about this for years and for decades. But as someone who thinks about this within the structures of organizations, there are 5 things that I like to talk about often within this space. And one is around policies. I think it's so key to think about what are the internal policies within your organization. Often I see in development and in global health and global development that we'll have offices in our Africa continent, so in Nigeria or Kenya or wherever, and we'll say, well, we're diverse because we hire people of color in Africa, but you don't get any brownie points for hiring Black people in Africa. I think what do your policies look like in your US offices, in your Europe offices? How are you making it easy to find and recruit people, because there's many qualified people? What are you doing about that? And I work at the Gates Foundation, which obviously has a lot of work to do in this space. But I'm really encouraged that we're having conversations now internally about, well, what does this look like? What is our approach to the vendors we work with? What is our approach to hiring? How are we more inclusive as an organization? Like, there are really great combos that are happening, great structures that are being set up. And I think that's where the work begins, setting up these structures and setting up these processes internally. Second thing I think to grapple with is power. In this space, we talk about empowerment so often. So to the question that was just asked, how do we get the grant? How do we get the money? And I think when we'll begin to see shifts is when people who are making decisions about grants are also people from those communities, are also people of color. So for me, empowerment is getting a grant, but power is deciding who gets the grant. Empowerment is getting to tell your story, is getting to speak on a panel, but power is getting to decide what stories are told, what ideas are heard. And so I think that for people who are in power, sharing power is a big key. It's saying, hey, you know what, I may not be the best person to provide advice on grants about, for example, maybe LGBTQ IA plus communities, but if somebody else can't, maybe I'm not the best person to provide advice on people living with disabilities, but let me share that power with someone else who has more expertise in these communities. Privilege for me is key. I always talk about spending your privilege. And that means that for me, I know that I have a lot of privileges. I work at a great foundation. How do I share speaking gigs that come my way and say, hey, I'm not the best to speak on XYZ? Pay is huge as well. I always say, how are you paying the people in your organizations? Do you have transparent processes? And then programs. Often in development and global health, I always see a hesitancy to address issues in America. So we often want to go, well, it's happening in Africa. What's happening in the US? I think really being able to have a lens that incorporates US issues is key. To the question that was asked, I do not have specifics around racial justice, but I know that the Reform Alliance is doing fantastic work. And I don't know if you've checked out Reform Alliance, but that's a great one. And I also wonder, Steve, if you have ideas for how to make your grant proposals and how to get funding from organizations. I think you have a lot of experience there, so I'll defer to you on how to really just get funding from organizations on specific initiatives.
Fantastic.
Yeah, first of all, I want to capture what Blessing just said and make sure I figure out how to apply that in more of my work. But you know, first of all, thank you for your work. I forget the name of the person that asked the question, but you know, your commitment. We've got to address the school to prison pipeline and mass incarceration of Black Americans and people of color in this country in such a disproportionate way. Talk about inequities and injustices. And so I too just joined a board of an organization that's trying to look at, you know, a very small local organization, but looking at this sort of same set of questions around, you know, what are alternatives to juvenile detention, which are disproportionately affecting people of color, and how do we come up with alternative models? I do think it suffers. First of all, it suffers the same challenge every NGO, and sadly, I probably would have hair if I hadn't either been on the board of or managed too many NGOs where finding money is just the nature of the beast. These are not market driven. There's a reason they're not market driven, which is they're addressing problems that markets and governments and private sector are failing to address adequately. So, but it's always a scramble for resources, and particularly for small organizations who don't have the money or the power to, you know, build big brands and big, you know, so it's always a challenge. And I do think there are 3 or 4 things. One is, you know, to Blessing's point, there are these sort of alliances, and some of those alliances are effective at bringing together resources that then can be distributed. You have to kind of navigate that, but I think that so you can kind of rise above your own, you know, kind of space or community. 2, I do think. You know, measurement. I mean, I think what we need, you know, when I teach in this area is, and I'm not an obsessive measurer, and I'm like, you know, there's a point where it's enough already, but I do think demonstrating why your solution in the social sector is effective and maybe unique, or at least, you know, it has legs, is really important. So people are going out there often, you know, pleading the problem, which is, you know, a big problem. But I think people need to also go out there and explain why their solution is an effective solution, and that's going to get you actually more scalability in the long term. I mean, we understand we have to put it in the problem statement first, but we sometimes just stop with the problem statement as opposed to here's what we can do, and this is how we measure it, and this is how we'd scale it. And then finally, you know, I do think that there are increasingly, you know, kind of off the radar screen foundations and funders who are beginning to take this issue more seriously, just because of the movement itself. Some of those aren't the usual suspects, and this is one of the challenges in philanthropy, but where you know, the usual suspects, people focus on, you know, Gates, Ford, Rockefeller, et cetera. And actually there's billions of dollars being, you know, given every year by family foundations, community foundations. And so, you know, kind of tapping into the networks and the literature that talks about which foundations are emerging, giving in this area might be a useful place to go, assuming that, you know, you're going to be focused still on managing this mainly by a philanthropic effort rather than a earned income model.
Blessing, did you want to add to that, or should I move into the questions? Okay.
Covered it all.
Okay, so now we have from Kevin M, going back to Steve's first thought, how can we promote more good news? Everything we see here makes it seem like the world is on fire.
Well, I mean, I don't want to say the world isn't on fire to begin. I think that there's urgency around a lot of issues, obviously climate and recovery from COVID, and the issues we just described around race and racial equity are and there's you start that list, there's many big challenges, and it's been a little bit of a challenge in the book itself because I'm generally optimistic and say, look, the world is actually getting better generally, but it doesn't mean we don't have a heck of a lot of work to do, and that progress is inevitable or equitable. But I do think we need to spend more time sharing the stories of the trend lines. And this is what I was trying to do, which is to say, look, we have setbacks and we have challenges, but the species itself, particularly aided by science and now aided by data and aided by community resilience and has been unbelievably effective in the last several hundred years, increasingly addressing huge problems that are just as big as the problems we face today, whether it's, smallpox or, big, plague and things like that, all the way to civil wars and other areas. Now we have new problems, climate, nuclear, other thing, but we are not any, and certainly the sense of divisiveness in the US right now is very high, but we are, if you read history, we've been divided before and we've come back together. So I would say, we do need to tell that story. We need to educate people about and not in a Pollyannish way or a naive way, but the power of community and the power of science and the power of data and the power of community activism, what it has done in the past. And I always like to remind people that in health, at least, and this is different than, but the top at the end of the 20th century, the bottom 10% of the world, and this was global, some of the data, lived better than the top 10% of the world lived a century before. So if you think about that, the top 10% of the world in the 1880s lived worse than the bottom 10% of the world lived in the 1990s. And so that's that kind of, the arc of justice keeps moving and bending. It's slow, it's not inevitable, and it's also not even. So it ups and downs. But I just think those are the stories we need to share. And because otherwise you've got to channel this outrage somewhere. And why don't you start with some, something that you can build momentum around?
Wonderful response. Did you want to add to that, Blessing?
Sure. No, and I really empathize with that question because often it's just like we're inundated with negative news all day long, and it can feel just really heavy. But this is where I'll make a shameless plug for Goalkeepers and say this is exactly what we do, is we try to tell the stories of hope in the middle of the fires, people who are doing fantastic things. In our report this year, for example, we talked about India and how they had innovated with their cash transfer systems and in a way that really benefited women that we hadn't seen elsewhere. Vietnam had a contact tracing system that really was a model for the rest of the world. In Nigeria, we saw private sector come together and raise about $80 million for response. But also in the US, we saw the creative sector just engage people in ways that gave us hope in really, really dark times. And so I think that's what we with Goalkeepers is try to tell the positive stories, and go to Gates Foundation stroke Goalkeepers, you'll see some of the people that we celebrate each year. But I think for all of us who are in this space, what I try to do is just to disconnect. I don't read the news all day long every day. I don't think it's necessary. I really just try to find ways to unplug. And I think as you do this work, just sustaining your soul is so important, and finding ways to do that is so important.
That is very sage advice. We have time for one more question, and it's in line with what we've been discussing. And it comes from Chelsea Gorkowskiewicz. I'm sure I mispronounced it. I apologize. On a micro scale around the kitchen table, what tools do you employ to try to bridge the divide between ideologies when both sides are pretty entrenched in their side? Sounds like some pre-holiday planning to me, because that's been a rough time in the United States and families. They're very polarized, but I'm sure it's also a broad question as well. Do you want to start or end, Steve?
Either way, blessing.
Well, saying, why don't you, how do you bring people together who are polarized?
Sure, it's a good question. Steve, you said that you grew up in Montana. I went to school in Oklahoma. I was born in Oklahoma. And my entire life has been about bridging different worlds. I'm Nigerian and I'm American. Grew up in faith and conservative spaces and just thinking about how to bridge. And I think the number one thing is conversation. And it's being patient with those conversations. I've had some of those really hectic conversations this year in a very heated political climate. And I cannot overemphasize the importance of just having continual conversations. The reason why I set up the She Tank was specifically that was we were often rushing to go to policy solutions. In Nigeria, there was a bill that many had been advocating for, myself included, called the GEO bill. It was the Gender and Equal Opportunities Bill. And it was a bill that was supposed to provide basic women's rights. Things like criminalizing domestic violence and child marriage. And that bill continued to fail for 10 years. And the last time I went before the floor, we heard people reading from the Bible, and it occurred to me that, people are reading from the Bible and the Quran to say that, religion is a barrier to gender equality, and we shouldn't have this bill because it goes against our religious beliefs. And we're often focused on funding policies and financing. We're not tackling mindset, we're not having conversations. And so I started the She Tank to say, how do we just begin to take a step back and have these conversations in really, really small spaces? And it's hard and it's frustrating and you don't get solutions. And even in the feminist world, there's a huge spectrum, right, of ideology, a really huge spectrum of ideology. And I try to be as sensible. That's the space I like to think about. What is some kind of middle ground? But even middle ground sometimes can be controversial. But conversation for me, I can never overemphasize that patient conversation, listening. In America, there's such a heated climate now where it's almost we don't even listen anymore. It's almost like listening is impossible to do when someone differs from us. And I hope that we get to a place where we can begin to just have conversations and to listen. Of course, sometimes speech is violent and I won't listen to anything that dehumanizes me. But to the point that we can have conversations, I will continue to stress that over and over again.
That's a very good last point that you just made about the perils of conversation, which I do agree, though, with the overall point you're making. Steve, maybe a little modification on the question. Given all that you know about social media, as we're trying to figure out how to bring people together, what challenges does the way social media has evolved around the world present in this country to facilitating the kind of collaborative conversation and patient communication across the divide that Blessing was just talking about?
Yeah, well, I certainly would, first of all, endorse. She could say it so much more eloquently than I can, but I'm from a family that is wildly divided on both sides, and we go into the holidays, although this year because we can't really have them, it won't matter. But with kind of navigating this every year, which is, how do you authentically listen? At the same time, I believe part of that, and you said at the end, is also sort of picking your battles, like knowing that you're not going to change people's hearts and minds. So why don't you just mainly understand versus try to, have an advocacy, and then picking where you're just going to either tune out or just say, hey guys, let's agree to disagree and walk away, because otherwise it just gets too fueled. And certainly social media has exacerbated both, I think, the divisiveness because of misinformation, because of the sort of data we now have to know that these become just big echo chambers, and where people just amplify their own points of view, often without anything, data. And because of intentions. So I actually speak in the book. In fact, yesterday we did one of these with Maria Ressa from the Philippines, who's, you know, the world, she's also featured in the book, a good friend, but she's also, you know, one of the journalists who's now been, you know, threatened with jail in the Philippines because of her criticism of Facebook as effectively destroying the Filipino democracy and probably the American democracy over time if we're not careful. So there's certainly a dark side that social media, you know, becomes these sort of places for misinformation. Of this, all everybody knows, a place for communities finding more power and divisiveness than connectivity. But I also think we're going to see, you know, I think over time, if we can regulate some of that more aggressively and we can educate better, I'm still quite optimistic that over time social media can be also a great place to unify people. Families have come together in ways that we've never seen before, using Zoom and social media and other tools. We're seeing you know, ways to filter things so you actually don't have to be barraged by certain issues. You can see the work that's been done even this year saying that, you know, notifying people that this is information that's incorrect, and we'll see more of that as we roll out the pandemic. So I'm reasonably optimistic that we will continue to have to chip away at this incredibly powerful tool, which is social media and digital, in a way, though, that we try to create new and better norms, and we have to regulate some of those norms through policy and other instruments.
Well, thank you, Steve. You have just been terrific, and Blessing, you have been an enormously wonderful panelist here today. And I'm very excited about your book, Undercurrents, and I think it's going to be a bestseller. And I hope everybody reads it and runs out and becomes their own version of activist, because we come in all flavors, as you have been saying. So thank you so much, and please enjoy your holidays. And for those who are on joining us, if we did not get to your question, I apologize. We had a number coming in to the feed, and I thank you all. And please enjoy safe, healthy, and happy, hopefully restful time off, okay?
Thank you for having me.
Thank you very much.
Thank you.
Thank you.